Doctors of Reddit, what is the most bizarre issue you've seen a patient trying to hide or mask? Do you have any medical conditions? No. What medications are you on? Proceeds to name at least 10 medications. Do you have any medical conditions? Sir? Nope. Are you on any medications? Metoprolol. So you have high blood pressure? No. The metoprolol keeps it down. My favorite. Do you smoke? Heavens no. Have you ever? Yes. But I've quit how long ago? This morning. Not a doctor, but when I was working as a med tech in Neo, we had a male patient approximately 7'5" come in with an extraordinarily low blood pressure, think 70/40ths, and a ton of facial and upper body bruising. He was brought in via AMS after the nurses at his nursing home found him on the floor in his room, where notably, there was some blood on the wall. The guy wouldn't talk to us regarding why he was there, but was very talkative in terms of pretty much anything else, sports, the news, etc. We couldn't for the life of us figure out what happened since we couldn't find any bleeding internally, his fluid levels were fine, and he had not left the nursing home, so there was nothing available for a high mechanism of injury. We eventually were able to get him talking after for hours, and he confessed that he had wanted to commit suicide and had taken the remaining amount of his prescribed nitroglycerin, used for chest pain, lowers your blood pressure rather quickly. Nitro is also the active ingredient in dynamite, but the amount in the pills is minuscule compared to what's in dynamite, and had tried to blow himself up by running into the wall repeatedly. He was a really nice guy that sent a card to us after everything. He was just extremely lonely. I admitted a guy for pneumonia, which was odd because he was young and strapping. No other medical issues. X-ray didn't look quite right. The pieces just didn't add up, and so I started questioning him more closely. Emmy, do you use any drugs? Patient. Drugs? That's disgusting. I'm no fucking druggie. I've never touched drugs in my life. I move on to other questions, and suddenly, patient, look, doc, I just want you to know I may have used cocaine once or twice years and years ago. I just snorted it though. That wouldn't cause this, right? Emmy. How long ago? Patient. Like 10 years. Maybe longer. Emmy. It shouldn't be affecting you after this long. Patient. More like 5. Emmy. Years. Patient. Ow. Like 5 months ago. This goes on forever, until he admits he just got off a massive crack binge the day before, where he spent the past 3 days in a hotel with some loose women smoking crack non-stop. He finishes with, "But I don't want you to think I'm one of those dirty druggies. No. I think you're the idiot who lied and was getting treated for pneumonia instead of getting the proper treatment for crack lung, which is what he had. Here's a tip. I genuinely don't care. I'm not your mama, your spouse, or your priest. Don't waste my time and endanger your health spewing bullshit. Whatever horrible twisted thing you think is too shameful to talk about, I promise you, I've seen worse." Not so much bizarre as clever. I drug tested a patient who should test positive for opiates as I prescribed them. We do that too. The urine looked totally normal, but the test came back bizarre. Had an insanely high specific gravity, means there was a lot of stuff dissolved in it. Sample was positive for opiates, but had 0 confirmatory metabolites, which your body turns the drug into in it. Otherwise, test was totally normal. It took me a couple minutes to figure out how this was possible. The patient was selling their pills instead of taking them, and didn't want to get caught. They crushed up the pill and put it into the urine. This made the test positive for opiates, but because it had never gone through their body, the testing machine found no metabolites. I use the case to find the smart med student in a group now. My aunt is a family doctor, so patients come to her with symptoms and she directs them towards a specialist based on her diagnosis. One day, an elderly husband and wife came into her office, and when asked why they had come in, the wife responded, "His foot has been smelling for a while and I finally convinced him to come have it looked at." My aunt, not hard of smelling, concurred that his foot stunk. She asked him to remove his shoe and sock. When he removed his sock, the bone from his big toe fell out of his toe and onto the ground. Turned out he had a very bad case of gangrene that had eaten away the flesh of his toe. He knew something was wrong but was stubborn and didn't get it checked sooner. And my big toe hurts now after typing this. My mother, the medical professional of our family, had a 13-year-old girl who was 9 months pregnant in the midst of labor, dilated to 10 centimeters and crowning in the emergency triage, swearing until she was black and blue that she was a virgin and that nobody knew what they were talking about. Her mother stood on the sidelines causing a commotion, demanding a real doctor make an appearance. Let's just say, when the twins made an appearance 10 minutes later, they were all singing a different tune. I met a teenage girl with a full-term pregnancy ready to give birth, but her boyfriend insisted the baby was premature because they only had sex 6 months ago. After the baby was born, he just said that the baby grew really fast. Sure. My cousin told me about a patient who complained about her nipple falling off all the time. She said she tried to glue it back on or use skincare creams to have it stick to her breast. Turns out she had not sure what stage anymore. Probably pretty bad breast cancer. From what I remember, the tumor got so big that the breast skin was stretched quite a bit. Somehow the plus friction led to an open, not healing and oozing wound which extended to her nipple. Well, nobody there understood how she didn't go to a doctor or a hospital earlier. Keep in mind this happened in Germany. She had a job, health insurance and everything. My cousin's nipple fell off. She didn't have cancer. It was just a botched boob job. A friend's nipple fell off after a breast reduction. She was out shopping the day after her stitches were removed and it literally fell off in her bra. She jumped in her car and sped to the doctor's office. A cop pulled her over. He didn't buy her story at first. Then she showed him. He gave her an escort to the hospital. Nurse here. One time had a patient come in with insane intestinal trauma. Had to have his colon stitched up. Said he was fishing and fell. His rectum just happened to fall perfectly on a fishing pole. Must have been a wild night to be fishing naked. Too many people have gotten out of the shower, slipped, and fell onto the box of cucumbers they keep in their bathroom. Not a nurse, but my mom works with nurses who have crazy stories. Here's 2 of them, both from nurses. A man came into the O with a birthday candle in his penis. He had stuck it in there to surprise his girlfriend on her birthday, but when he lit it, the melted candle wax stuck to him. This is probably the weirdest one I've ever heard. An old woman came into the O with a high fever, abdominal pain, dizziness, etc. She's showing signs of toxic shock syndrome, like when you leave a tampon into lawn. So the doctor decides to check the woman to make sure nothing got stuck up there. Sure enough, she looks up there and half shits her pants when she sees the beady little lie staring back at her. The doctor begins to pull it out, to which the old woman responds, "Put it back." Turns out the old woman, well past menopause, had gone to a bad witch doctor to help her get pregnant. Her recommendation: put a now dead turtle up there for a few days and she'd regain the ability to get pregnant. From a nurse friend. Guy came in with burns to his entire willy. He tried to say he got it by trying to shoplift a hot BBQ chicken from a deli down his pants. What he was really doing was fucking the chicken. Not sure if this counts because I'm a pharmacist, but a patient came up to me and asked if there was gluten in cocaine because she has a gluten sensitivity. I work in the lab and the pathology department gets the foreign body items removed from a patient's body after surgery. Recent one was a chorizo sausage. Glad I wasn't there that day. A patient came in with chest pain. Said they'd fallen and hit their chest on a table. X-ray was performed to evaluate for a rib fracture or collapsed lung. The X-ray instead showed a long metallic foreign body in the left chest, within the heart. When questioned further, the patient admitted to lying and that they'd actually shot themselves in the chest with a nail gun. The wound was not bleeding nor really noticeable. They were taken to the operating room and did quite well after open heart surgery. Not a doctor but an EMT. I had a guy who tried to tell us he fell while playing softball and hurt his ribs and arm. This was 10 o'clock at night. Come to find out, he tried to screw his drug dealer out of some money and the guy chased him down with a bat and beat him with it. So I guess he was kind of playing softball. A case of teenage pregnancy. where Madame Mama was present. Patient presented with amenorrhea and fatigue initially. Patient became visibly annoyed, and the first test suggested is a pregnancy test. Patient and mother insisted that she never had sexual intercourse, angrily, if I may add, even when the test results turned back as positive. No. You quack. I'm telling you she never had no sex. Nurse here. I had a patient come in for a hip fracture. While helping her to the bathroom for the first time, the CNA noticed something hanging out of her vagina. Turns out, she walks around with a prolapsed uterus and thinks nothing of it. My late dad was a surgeon and, when he was a resident, had a middle-aged male patient come in complaining of pain in the rectum. They examined him and found a vibrator lodged fairly deep. When they asked him how it happened, he looked extremely surprised that it was there and then explained, I was lying in bed and it was on and vibrating on the bed near me, and it sort of moved on its own. Guess it found its way up my ass all by itself. Loved hearing emergency room stories from my dad, and it sucks that he's not around to tell them these days. Not a doctor but a corrections officer. Had an inmate complain of pain in his penis. Took him to the facility hospital. He had screws jammed into his urethra. About 14 IRC. They took the screws out and put him on some psych meds. About a week later he cut his penis off with a broken mirror and flushed it down the toilet. The penis was never recovered. He freed Willie. I once saw a high school-aged kid come in with a dinner candle stuck in his rectum. He reportedly was using it to reach an itch. Apparently the itch was in his spleen because that thing was deep. Mom told me the story, and how she had previously asked him to not itch himself with other things of hers. I didn't ask for any more details. I honestly think she believed that he was just really itchy. I'm picturing some guy's girlfriend coming home to flower petals all over the floor, romantic music, and her BF's ass pointing upward with a lit candle in poking out. Sent a male patient into the bathroom to collect a urine sample. Took him much longer than expected. He misunderstood and gave a semen sample. One time a lady came into the with itching, pain in her vagina. She said she had used some garlic as a natural way to fight a yeast infection. She didn't heat the garlic. Garlic up your cooch to treat a yeast infection is an old folk remedy. Some people swear by it. I've heard it burns like hell, though. Not a doctor, but a friend is. Patient very hesitant with what was actually up, so went for x-ray. Unmistakable shape of a Barbie doll up his arse. So, emergency surgery, and it's removed. He comes to, and sees his wife at his bedside. He panics, and when she goes to the ladies, asks the nurses not to tell her what's happened. She comes back in, and one of the nurses brings back the shit-smeared Barbie doll, in a small, plastic bag. Wife glares at him. I fell on it. Well, I'm a radiographer and sometimes you see those objects stuck deep inside patients. I've seen a spray can, a screwdriver, a potato, a dildo gone way too far. But the more surprising one was a woman that used a Coke 33cl glass bottle as a dildo, and she didn't have enough so she used another. I guess she felt nothing due to excitement cause she pushed the first bottle into her uterus, breaking the cervix by pushing with the second bottle. Had this patient come in once, you could clearly see she was north of 60. Wrinkles with a cute no-teeth smile. Asked her age, gives her crooked cute smile and says, son, I'm 40 years, but my grandchildren say I look quite young. From a friend. Somewhere deep in Alabama, an elderly lady came in and said that she was having stomach pain or some kind of pain. When he was examining her, he noticed she had pain near her uterus, female areas. So, she got undressed for another exam, and she casually said to him, now, I do got leaves growing out of my Virginia. He looked and saw that by God she did, and that she put a potato in her vagina to hold up her prolapsed uterus. Thanks for watching. Share your stories in the comments.